Chapter 3: Why it took so long to get a diagnosis. If it took you months or even years to receive a diagnosis, you are not alone, and it's not your fault. One of the most painful truths about lichen sclerosus is that it's often missed, misdiagnosed, or minimized for far too long. Many of my patients have been told it's just thrush, eczema, or a hygiene issue. Others have been prescribed creams that never worked, not because they were wrong about their symptoms, but because they were handed the wrong label. In this chapter, we'll explore why the path to a correct diagnosis is so often delayed and how you can advocate for better, faster care. 1. The condition is under-recognized. Despite affecting around 1 in 70 women, lichen sclerosus is still poorly understood by many GPs, nurses, and even gynecologists. It's not routinely taught in depth in medical training, which means many clinicians simply haven't seen enough cases to recognize the signs early. 2. The symptoms mimic other conditions. LS symptoms overlap with many common conditions, including thrush, itching, discharge, eczema or dermatitis, redness, inflammation, urinary tract infections, burning with urination. This can lead to repeated misdiagnosis, leaving the root cause untreated. 3. Vulval health is still a taboo. Let's be honest, vulval and vaginal health is still cloaked in silence. Many people feel too embarrassed or ashamed to speak up about intimate symptoms. Others are taught to tolerate discomfort or told it's just part of being a woman. Even within healthcare, there's a systemic discomfort around examining and discussing vulvas. In some cases, a visual inspection isn't even carried out and vital clues are missed. 4. Patients are often dismissed. Far too many patients have told me they were told, it's all in your head. There's nothing to see. Try different soap. Come back if it gets worse. These responses are not just frustrating, they're harmful. They delay treatment, worsen emotional distress, and reinforce the idea that your pain isn't valid. 5. LS can look normal in its early stages. Lichen sclerosus doesn't always present with dramatic visible changes. For some, the skin looks largely unchanged even while symptoms are intense. This can cause healthcare professionals to overlook the condition unless they're highly trained in vulval dermatology. How to advocate for yourself. It's not fair that the burden of diagnosis often falls on the patient, but many have had to push hard for answers. Here are some ways to empower yourself. Keep a symptom diary. Note when symptoms occur, how they feel, and how they affect your life. Ask for a vulval exam. This should be done gently and respectfully, ideally by someone with experience in vulval conditions. Request a referral. If your GP isn't sure, ask to see a vulval dermatologist or gynecologist. Know the language. Mentioning lichen sclerosus by name can prompt your doctor to consider it more seriously. Bring resources. Patient information, leaflets, or printouts can support your case and show you've done your homework. You deserve to be heard. A delayed diagnosis is frustrating and painful, emotionally and physically. But please know this: you are not difficult, dramatic, or wrong for seeking answers. You are doing exactly what you should be doing. In the next chapter, we'll talk about how LS affects your whole self, not just your skin. Because the emotional and psychological toll is just as real.